Right now, a silent biological crisis is unfolding inside the blood vessels of adults over the age of 60. We're examining an urgent, severe degradation of the cardiovascular system, a structural deterioration that leaves you suffering from heavy legs, poor circulation, and a body that simply cannot effectively transport life-saving oxygen. Consider this a critical medical alert. Today, we're going to outline the exact clinical protocols required to halt this decline and force your vascular network to function effectively once again. So let's address a fundamental biological question. You've likely been told your whole life that drinking plain water is the ultimate solution to circulatory fatigue. But clinical evidence dictates otherwise. After age 60, your vascular system severely loses its responsive capacity. Simply forcing more volume into degrading vessels is biologically insufficient. Your body's response to plain water weakens substantially, meaning hydration alone can no longer compel stiff, unyielding arteries to open up and deliver blood.
The reality here is severe. If you're experiencing heavy legs, cognitive fatigue, or numb extremities, listen closely. These aren't just minor inconveniences of getting older. They're acute symptoms of a failing circulatory system. Plain water cannot reverse this silent vascular decline. Your system requires targeted biochemical triggers. We're talking about specific compounds that force your blood vessels to actively respond rather than just relying on passive fluid volume.
To really grasp this, look at the exact biological mechanism of this failure. The contrast is stark. Before 60, youthful arteries are highly flexible, they're rich in nitric oxide, and they facilitate incredibly smooth blood flow. But post-60, the vascular response is defined by stiff arteries, drastically depleted nitric oxide, and sticky aggregating platelets. This structural degradation drastically slows your circulation, and it places an immense, dangerous workload on your aging heart. This brings us directly to Phase 1, silica-induced endothelial reinforcement.
We have to immediately address the structural integrity of your veins and arteries, moving far past casual remedies. To understand this intervention, you need to understand endothelial function. This is the critical ability of the connective tissue within your blood vessel walls to remain strong, flexible, and capable of expanding under pressure. As you age past 60, these walls dangerously thin out and stiffen. When this happens, oxygen delivery to your vital organs and extremities becomes severely compromised.
But empirical data proves we can actually reverse this. Research published in the Journal of Nutrition, Health, and Aging demonstrates that targeted silica intake yields a massive 12% improvement in arterial flexibility over just 12 weeks. Furthermore, clinical data in phytomedicine shows that rosmarinic acid cuts vascular resistance by 15% in older adults. Together, these compounds rapidly rebuild vascular elasticity and drastically reduce the strain on your heart.
Here is the precise, step-by-step extraction protocol to obtain these exact compounds. You need to slice half a medium cucumber and lightly crush 10 to 12 fresh mint leaves to release that rosmarinic acid. Then, submerge them in cold, filtered water for at least 30 minutes. Now, hear this clearly, it is an absolute medical necessity that you use an organic cucumber. The vital silica is concentrated right in the skin, and you cannot risk dangerous pesticide leaching directly into your reinforced hydration. Now we advance to Phase 2, anticoagulation and nitric oxide synthesis.
Strengthening your vessel walls is insufficient if the blood inside is thick and sluggish. The crucial concept here is nitric oxide. Think of it as the master biological switch. It chemically signals your blood vessels to relax, to widen, and to allow life-saving blood to flow freely to your brain, heart, and extremities. In adults over 60, this molecule is critically depleted. Without synthesizing new nitric oxide, your blood vessels remain dangerously constricted.
The good news? We can force the synthesis of this molecule. Clinical trial data shows that high vitamin C intake results in 23% more available nitric oxide, according to the American Journal of Clinical Nutrition. Concurrently, data from thrombosis research proves that compounds called gingerols chemically prevent blood platelets from dangerously aggregating. That yields a staggering 19% reduction in platelet clumping.
To synthesize this reaction, you must follow Extraction Protocol 2 strictly. Extract the juice of 1 fresh lemon to secure the vitamin C. Then, slice 1 inch of raw ginger root into thin coins and submerge them in water for 15 minutes to extract the gingerols. You must administer this first thing in the morning on an empty stomach.
This guarantees maximum, unobstructed absorption directly into your bloodstream while your digestive system is inactive.
Moving directly into Phase 3, immediate vasodilation.
While previous protocols build their effects over a period of weeks, this phase is an aggressive, fast-acting intervention. Pay close attention to this metric, 20%. That is the astonishing increase in localized muscle blood flow achieved within a mere 3-hour window after initiating this specific protocol. We aren't talking about a gradual change here. This is an immediate, forceful, physiological response in an aging body.
Heavily documented in the journal Hypertension, this intervention utilizes pure dietary nitrates. Your body converts these nitrates directly into nitric oxide. The results are severe and immediate. It rapidly drops blood pressure, and as noted in the Journal of Applied Physiology, it improves physical endurance by 16% purely through optimized oxygen delivery. Be aware, this protocol will harmlessly expel a red pigment called betanine through your system, which is just a normal indicator that your body is processing it.
Extraction Protocol 3 requires absolute precision. Isolate 100 milliliters of pure, unsweetened beetroot juice. You must dilute this heavily with 300 milliliters of water. This precise dilution ratio is required to prevent severe gastrointestinal distress in an older stomach and to ensure a steady, time-release systemic nitrate spike rather than a volatile, dangerous surge. Administer this exactly 2 hours prior to physical exertion.
Next is Phase 4, microcirculation enhancement. We are now advancing to the clinical treatment of the body's smallest, most fragile blood vessels, your capillaries. The clinical data on this is absolutely definitive. We see a massive 31% documented increase in microvascular capillary flow in older adults. This profound vasodilation is triggered by the rapid release of highly specific neuropeptides directly into the bloodstream.
The biological reality of this is stark. On one side, you have untreated peripheral capillaries, which ultimately lead to tissue death, numbness, and suffering. On the other, capsaicin-treated capillaries. Studies in clinical nutrition demonstrate that capsaicin forces a 26% greater peripheral blood flow, resulting in a rapid, restorative flush of oxygen deep into those starving tissues.
Protocol 4 demands strict adherence. Heat water to a sub-boiling, comfortable temperature. Dissolve precisely 1/8 of a teaspoon of capsaicin or cayenne powder. Administer this 30 minutes pre-meal. Now, I must issue a stern medical warning at this juncture. Capsaicin is one of the most powerful natural vasodilators known to science. If you are currently prescribed blood-thinning medication, you must consult your physician immediately before initiating this protocol, as it will intensely magnify those effects. Finally, we reach Phase 5, complete arterial restoration.
This is the most potent protocol in our arsenal, designed to clean up decades of oxidative damage. To understand its immense power, you must first understand flow-mediated dilation. This is not some casual metric. It is the ultimate clinical gold standard measurement, used directly by cardiologists. It rigorously evaluates exactly how effectively your blood vessels can expand and contract to push blood forward. The efficacy data here is truly staggering. Published in the Journal of Human Hypertension, this protocol achieved an unprecedented 44% improvement in flow-mediated dilation. Simultaneously, phytotherapy research recorded a 17% absolute reduction in severe arterial stiffness. It achieves this by flooding your system with anthocyanins, which drastically reduce the oxidative stress lining your arterial walls.
To harness this power, you must execute Extraction Protocol 5 flawlessly. Submerge 2 tablespoons of dried hibiscus subderfa petals in 1 liter of cold, filtered water. You must cold steep this compound for 8 to 12 hours. It is an absolute imperative that you do not let the water temperature exceed 70 degrees Celsius at any point. Heat irreversibly destroys the life-saving anthocyanins required for this arterial restoration.
I want you to listen carefully to this conclusion. This 44% improvement stunned researchers because it rivals the effects of some prescription medications designed specifically for vascular health. This is not a minor dietary adjustment. This cements the scientific validity and the immense, life-saving physiological power of adhering to these strict daily protocols.
The evidence has been presented. The exact mechanisms of your cardiovascular failure have been detailed. Your vascular system is silently, progressively degrading with every single passing day. The biological impact is severe, and the true risks remain completely hidden right up until they become critical. So the demanding question remains, which clinical protocol will you initiate today to halt this decay and restore your life-saving blood flow? It's time to take immediate action. Start with one protocol and reclaim your vascular health.